Somewhere tonight, in a hospital with clean floors and modern monitors, a surgeon is going to write an order for leeches, live ones. Delivered in a chilled container from a licensed biological farm, logged into the pharmacy system, handled with gloves, and applied to a patient's skin under supervision. This is not folk medicine. It is not an alternative therapy sold at the back of a shop. It is a prescription cleared by the United States Food and Drug Administration, sitting in the same regulatory category as a surgical instrument. And the reason it works was written down in careful detail in an Indian medical text older than most surviving books on earth. The text is the Sushruta Samhita. It is one of the oldest surviving surgical treatises anywhere in the world. And it is worth being honest about its age straight away, because the internet is not. You will see it described as 600 BCE, 2,500 years old, older than Hippocrates. Scholars are considerably more cautious. The version that survives has layers, some older, some added centuries later, and the current form is often dated closer to the 3rd or 4th century of the Common Era. That is still extraordinarily old. It just is not the number the headlines use. What is not in dispute is what is inside it. More than 300 surgical procedures. Over 120 instruments described and illustrated in words. Classifications of fractures and dislocations. Cataract technique. Reconstruction of a severed nose using a flap of the patient's own skin. A procedure so durable that 18th century British surgeons traveled to India to learn it, and which modern plastic surgeons still call the Indian flap. And within that text, a chapter on leeches. The Sanskrit name for the practice is jalaukavacharana. Jalauka means leech, and the word itself is rather beautiful in its literal sense. Something whose life is water. The chapter is not vague. It divides leeches into 12 varieties, 6 described as poisonous and 6 as safe to use, and gives each one a name and a physical description. Color, shape, where in the water it is found. It explains how to catch them, how to keep them, how to store them in a pot with clean water and moss, and how to feed them. Then it explains the procedure, where to place the animal, how to encourage it to attach, how to keep it in position, and what to do if it will not bite. How long to allow it to feed. How to remove it, which involves sprinkling a powder on its mouth to make it release rather than pulling it, because pulling tears the wound. And afterwards, how to care for the site, and how to make the leech disgorge what it has taken so it can be used again. That is not a folk remedy passed down by rumor. That is a clinical protocol. If you want to read the source material rather than take this video's word for it, the Sushruta Samhita and the Karaka Samhita are both available in scholarly English editions. And there is a free chapter-by-chapter online edition of the Karaka Samhita maintained by a research center in India. Links are in the description for anyone who wants to go further than a 12-minute video can take you. Everything here is offered as history and education, not as medical advice. Those two texts, incidentally, divide the work between them. Charaka is the physician's book, concerned with internal medicine, diagnosis, diet, pharmacology, and the training and ethics of the doctor himself. Sushruta is the surgeon's book, where Karaka reasons about causes, Sushruta describes procedures, and insists that a student practice cutting on gourds, melons and cucumbers, and bandaging on models before ever approaching a living person. That instinct, practice on something that cannot be harmed first, is now standard in every surgical training program on earth. Now for the part where this story gets complicated, because a great deal of it is going to sound like vindication, and it is only partly that. Sushruta placed leeches inside a much larger practice called raktamokshana, bloodletting. He organized it carefully. There was bloodletting with instruments, including venesection, opening a vein directly, and scarification, making shallow cuts across the skin. And there was bloodletting without instruments, which used leeches, an animal horn, or a hollowed gourd to draw blood by suction. The underlying theory was that certain illnesses were caused by blood that had become vitiated, spoiled, or imbalanced, and that removing some of it restored order. That theory is wrong. Not partly wrong, not wrong in its details. The general principle that removing blood corrects disease is simply not how the body works. And the same idea arrived at independently in Greece and carried through Europe for 2,000 years as humoral medicine, killed an enormous number of people. The most famous of them is probably George Washington. In 1799, with a severe throat infection, he was bled repeatedly over the course of a single day. Modern estimates suggest he lost something in the region of half his total blood volume. He died that night. The infection may well have killed him regardless. The treatment did not help, and in France in the 1820s and 30s, a physician named Broussais promoted leeching so aggressively that the country was consuming tens of millions of leeches a year. The species was pushed toward extinction across Western Europe. It was, by any reasonable measure, a medical disaster driven by a theory that had no basis. So when germ theory arrived and humoral medicine collapsed, leeches went with it, discredited, filed away as a symbol of everything pre-modern medicine got wrong. For roughly a century, that is where the story ended. Before the next part, one small thing. Research like this takes a long time, mostly in cross-checking, because the difference between a real historical claim and a repeated internet claim is usually several hours of reading. If you would like to support that, there is a Ko-fi link in the description. It genuinely helps this channel keep making the long ones. Some of what comes in also goes towards students at a gurukul, a traditional residential school where this kind of knowledge is still taught the old way, teacher to student. If that is something you would like to be part of, the link is below. No pressure at all. Now, back to the leeches and to the thing nobody expected. In 1960, two Slovenian surgeons, Durganč and Zdravič, published a short paper in a British plastic surgery journal. They had used leeches on skin flaps, not to balance humors, not to remove spoiled blood, for a specific, narrow mechanical problem that had nothing to do with any of that. Here is what they were dealing with, and it is worth understanding properly because everything turns on it. When a surgeon reattaches a severed finger or moves a flap of skin from one part of the body to another to rebuild a face after cancer surgery, they have to reconnect the blood supply. That means two different kinds of vessel, arteries which bring blood in under pressure, and veins which carry it back out. Arteries are thick-walled, muscular, and relatively forgiving to stitch. Veins are thin, floppy, low pressure, and far more likely to fail. So a very particular disaster becomes possible. The artery works, the vein does not, blood keeps arriving, nothing leaves. The tissue swells, darkens, turns a deep purple, and begins to die from the inside out, drowning in the very blood that was supposed to save it. Surgeons call this venous congestion, and once it sets in, the options are few. Sometimes you can go back in and revise the connection. Often you cannot. Without drainage within hours, the finger is lost, or the flap dies and the reconstruction fails. What that tissue needs is not a theory of humors. It needs a small, controlled, continuous leak in exactly the right place, for long enough that the body can grow its own new drainage. There is no machine that does this well. There is an animal that does it perfectly. A leech attaches. It draws off 5 to 15 milliliters of blood, which relieves the pressure directly. That much is obvious. But the mechanical drainage is almost the smaller half of the effect. The real work is in the saliva. In 1884, a physiologist named John Barry Haycraft found that extracts from leeches prevented blood from clotting. The compound responsible was later isolated and named Hirudin, from the Latin for leech, and it is a genuine anticoagulant, potent, specific, and studied pharmacologically ever since. Hirudin is why the wound keeps bleeding gently for hours after the animal is removed. The leech is not just a small pump. It leaves behind a chemical that holds the drain open long after it is gone, and Hirudin is only one compound among many. Leech saliva also carries a substance that spreads the effect through tissue, another that helps break down clots, vasodilators that widen local vessels, and compounds with anesthetic properties, which is why the bite is largely painless. That last detail is worth sitting with. The animal evolved a local anesthetic so its host would not notice it feeding. Modern surgery now uses that same property so a patient can tolerate the treatment. By 1960 then, surgeons had a problem with no good solution and an animal that happened to solve it exactly. Through the 70s, 80s, and 90s, use spread quietly through microsurgery departments. Then on the 21st of June, 2004, the United States Food and Drug Administration granted clearance to medicinal leeches as a medical device. The file number is K040187 if you would like to look it up yourself. The clearance is held by a French company that has been breeding leeches since the 1800s. The stated indication is precise. An adjunct to the healing of graft tissue where venous congestion may delay healing, or to overcome venous congestion by creating prolonged localized bleeding. That is the whole clearance, one narrow use. And this matters enormously because the internet has taken that clearance and stretched it into claims it does not support. Leech therapy is not cleared for detoxification, for arthritis, for heart disease, or for cleansing the blood. Those uses are off-label or unstudied. The FDA cleared one thing. It is also not remotely something to attempt yourself. Clinical leeches are laboratory-bred, sterile, single-use, and disposed of as biohazard waste. Patients receive preventive antibiotics because leeches carry a bacterium called Aeromonas in their gut that helps them digest blood and can cause infection. Wild leeches from a pond carry whatever was in that pond. This is a prescription treatment under supervision and nowhere near a home practice. So what should you actually take from this? It is worth picturing what this looks like in practice, because the reality is stranger and more careful than the word leech suggests. The animal arrives at the hospital pharmacy in a sealed container, refrigerated from a licensed breeding facility. It has never touched a pond. A nurse rinses it in sterile water. The patient's skin is cleaned, and because a leech will wander toward warmer, better supplied tissue if allowed, it has to be contained. Surgeons have improvised various solutions for this over the years. One published method involves cutting the end off a small plastic cup, gluing the rim to the skin around the congested area, and dropping the leech inside so it cannot leave the zone that needs draining. The authors of that paper called it a leech condo. Medicine is not always solemn. The animal feeds for 20 minutes to an hour, swells to several times its size, and detaches on its own when full. It is never reused between patients. It goes into biohazard waste, and the wound is then left to ooze gently for several hours, which is the point, and which nursing staff monitor and document like any other output. Then, if the tissue is still congested, another one goes on, sometimes for days. Sometimes dozens of animals across a single reconstruction. The reported results are genuinely good. Reviews of flap salvage with leech therapy report survival rates in the region of 65 to 80% for tissue that was otherwise heading for failure. In a specialist center, that is the difference between a person keeping a finger and losing one. Now hold the two halves of this story side by side because the lesson is in the gap between them. Sushruta's theory was wrong. Blood does not become spoiled. Removing it does not rebalance anything. Every reason he gave for using leeches has been replaced, and his technique survived anyway. Not because the tradition was secretly right all along, because a careful observer, working without a microscope, without germ theory, without any of the framework we now consider essential, noticed something real. Apply this animal to swollen, congested tissue, and the swelling goes down and the tissue does better. The observation was accurate. The explanation was not, and medicine kept the observation. That, honestly, is a more interesting outcome than vindication would have been. It suggests that careful attention to a body can produce genuine knowledge even inside a completely mistaken model of how bodies work. Sushruta also insisted on things the theory did not require. Use only these 6 varieties. Store them in clean water. Do not pull the animal off. Care for the site afterward. None of that follows from humoral theory. All of it follows from watching closely and noticing what went wrong when you did it badly. So tonight's practice is not leeches, obviously. But there is something in this worth taking into your own body and it comes from the mechanism rather than the animal. Venous return, the journey of blood back toward the heart, is the weaker half of your circulation too. Your arteries have the heart pushing behind them. Your veins largely do not. They rely on one-way valves, on the squeeze of your calf muscles as you walk, and on gravity when it happens to be helping. Which is why, at the end of a long day standing or sitting, your legs feel heavy. That is mild venous pooling, not dangerous. Just the slow half of the system falling behind. Sit on the floor with one side of your body against a wall. Then swing your legs up the wall and lower your back down. So your legs rest vertically and your hips sit close to the base of the wall. Let your arms fall open at your sides. Yoga calls this Viparita Karani, legs up the wall. It requires no strength and no flexibility. Stay for 5 to 10 minutes, breathing normally. Gravity now runs the other way through your legs, and the fluid that spent all day pooling downward has an easier journey back. Come out of it slowly. Bend your knees, roll to one side, and rest there for a breath before sitting up. If you are pregnant, have glaucoma, uncontrolled blood pressure, or any circulatory condition, ask a doctor before adding inversions of any kind. And if you ever have a limb that is swollen, hot, painful, or discolored, that is not a yoga problem. That is a same-day medical problem. Somewhere tonight, a surgeon is going to write an order for leeches, and it will be the correct decision. Made with modern evidence, in a hospital that has never once entertained the theory that produced it. The reasoning was discarded, the animal was kept. And a technique described in Sanskrit in a chapter about creatures whose life is water is still saving fingers in operating theaters that have never heard its name.